Welcome to Direct from the Doctors. I'm Dr. Emily Vincent, here with my friend and colleague, Dr. Tracy Lamel, and we're here today to talk to you about diabetes. Diabetes is a very prevalent condition in Louisiana. In fact, Louisiana has a very high rate of diabetes. Why is that? I mean, there are a lot of factors.
Could be our good cooking.
It could be our good cooking. Louisiana people tend to marry Louisiana people. Genetics, genetics is a strong component of diabetes, but in general, we do have a higher rate of diabetes than most states. So it's something important to talk about. I'm an adult medicine doctor, so I dealt a lot with diabetes in my practice and the complications of diabetes, which is one of the biggest reasons why I want to encourage everyone to get screened. Where will this happen? Well, everyone should be seeing your primary care provider at least annually for a wellness visit. And at that visit, your provider will know your family history. They're going to ask you, anyone in your family have diabetes? Anyone have complications from diabetes? And they're going to begin screening at a certain age, depending on your family history, your risk factors. You will get a blood sugar check, and you may have more in-depth screening depending on your risks as well, or what your blood sugar comes back as. But the bottom line is you're not going to really know. There are symptoms of diabetes once it gets bad and out of control, but a lot of times you can be living with diabetes and not know it. And problem with that is that diabetes has long-term complications. It can affect most anything, right?
Vision, eyes,
right.
Your limbs,
your kidneys,
your kidneys.
Put you at
your nerves,
complications of other chronic medical conditions worsening because of your diabetes. It's something that is treatable, but you need to know that you are at risk for it. You need to know if you have it, certainly, and you need to get on treatment for diabetes once you actually develop it. And then if you do have diabetes, you're going to need more frequent visits with your primary care provider for some of the reasons she mentioned, to make sure you're not developing long-term complications and to make sure that the medications you're being put on are actually controlling your diabetes to the best they can. It may also include you needing to check your blood sugars at home while you're on these medications. Let's kind of foray that into medication adherence and why it's so important to take your medications as prescribed.
Diabetes is a chronic condition, but millions of Americans and Louisianians live with it. It is highly manageable, and it is not necessarily always easy to manage, but it is manageable. But you have to do your part in that management. So we talk about specifically with diabetes, medication adherence, taking your medication when you're supposed to, as your doctor prescribed, at the time you're supposed to. That's so important. It's the difference between one medication working and your doctor having to change you to another medication because of complications. But is that complication because you weren't taking your medication or because the medication wasn't working? And that kind of information is necessary and important so that they can help you manage your disease better.
That kind of goes for all diseases too.
Pretty much.
You don't know if a medication's working if you're not taking it. And there's a reason why your provider put you on the medication. If you're having something that you feel is a side effect from a medication, absolutely communicate with your provider about that, because you may need a change, or it may not be a symptom of the medication, it may be a symptom of something else, but those things you won't know unless you communicate that. But medication adherence for any disease process is so important, because the whole point is we're trying to manage those diseases that we know can cause worsening complications in the future. And medication, by and large, often you're going to be put on medication to manage chronic medical illnesses, and diabetes, of course, is one of them. And there are so many ways that diabetes can be treated. Some people are eligible just for diet and exercise. It's going to be very few people, though.
Right.
Most people will require some medication. Most people are going to need to check their blood sugars, like I mentioned, and keep a log of those, or they may have a monitor that helps them to note what their blood sugars are so their provider can review those. But in general, it's going to vary depending on the person, depending on, like she said, how severe your case of diabetes is, the type of diabetes too. Because
I was going to say that next. There are different types of diabetes. Some types of diabetes, you will have to be on insulin your whole life. That people live with it and they manage it. and it's doable. But taking your medication when you're supposed to, how you're supposed to, is very important. And there are lots of reasons people do not adhere to medication. So as Dr. Vincent mentioned, sometimes it can be, I don't like the way it feels. I don't like the side effects. I'm worried about interactions. But other times it can be something as basic as I can't afford it. And that's common. Financial and social situations can lead people to either not get their medication or make medication last longer than it should because they're skipping doses. And if you have those kind of concerns, it is very important that you talk to your provider about it. They can get you the right help and help guide you through that process, either whether it's your provider who's prescribing the medication, sometimes your pharmacist, and as always at Blue Cross Blue Shield Louisiana, also Louisiana Blue, you can call us. We have health coaches that can help you, guide you through those situations. We have social workers, we have counselors, we have dietitians, we have pharmacists, and we have nutritionists who can help you on your diabetes journey and help get you the help you need. There are lots of programs that can assist with medication costs if that's something that is an issue for you, but you have to talk to us so that we know it is a concern and we can reach out and find out if you qualify for those programs.
And sometimes it can be as easy as changing a medication that's very similar to a lower cost medication. It works the same, but it has a different name, a different manufacturer, and it just is who is covered by your particular health plan. And we are all under the umbrella of Louisiana Blue, but I will say that not all of Louisiana Blue members have the same pharmacy benefits.
Exactly.
And so it is confusing often, but one thing that we can help you with here at Louisiana Blue by calling our care team is what is on my formulary and what could I possibly be on that is a lower cost drug for me to help me with affordability and making sure that I can afford to take that drug every month like I need to.
And seeing your doctor on at regular intervals for your diabetes can help prevent complications or at least stop them at the pass.
Absolutely.
You know, it's much better to go to the doctor when you're feeling great than to wait until you are dragging in there. And then there's so much more to do, so much more intervention, so much more medication, so much more time and energy. Better to get it before it's a problem. It's always easier to manage something before it's a problem. It's easier to manage a drip than it is to manage a full-out flood.
True, because with diabetes especially, it can impact all of your other underlying medical conditions. As a hospitalist, I would see patients who would come in and they may just have the flu, but because they have diabetes, their flu is going to be worse than the person down the hall who has the flu. It can impact really every part of your life.
We have seen people, unfortunately, lose their sight because of diabetes, get an amputation because of diabetes, end up on dialysis because of diabetes.
All things that are preventable
if you with appropriate management.
Right, if you know about it early and you're appropriately managed. So again, encouraging you to go see your wellness provider at least once a year, maybe more, depending on your history, and know your numbers. Have them check your blood sugar. They're going to anyway, and know your risk so that you know how you can prevent your future medical problems.
Absolutely. And if you need further coaching or assistance with any of that, again, you can reach us at Louisiana Blue. Our website is lablue.com, or you can call the number on the back of your card. We can help guide you through your healthcare journey to assist you in any way you need.